Morning, this is James Cummings. I am going to demo Josh Mandel's Health Skillz Direct Patient Access for AI Agents. He originally presented this live as a demo to ePatient Dave, Hugo Campos, and Giles Freeman. I wanted to take it through my son William, who is seen by 4 Epic providers: Cleveland Clinic, Yale, NYU, and Boston Children's. Josh says how AI agents can connect to patient portals via Smart on FHIR and why TEFCA isn't yet delivering on its promise to patients. This is important for me because TEFCA or TEFCA IS does not have a proxy solution. Having 2 boys with rare diseases is something that makes a caregiver's ability to access and aggregate their health data important. This is Josh's slides of the presentation on his blog. I'm going to scroll down. You can read this if you like, to the link. Click here to start Health Skillz session. When you click on that, it takes you to Claude AI, and then it will populate the prompt for you. There we go. Please use the skill. Start a session for me. So I hit start, and then it will load the skill into Claude. So it's working. Okay, your session is ready. Please click the link below to connect to your health records. Clicking here, open outside external link, and it takes you to a Smart on FHIR application that Josh built. I'm lucky that I have 4 major health systems that have working endpoints, but we'll type in Boston Children's. First one pops up, 37 locations, connect, and then it will take me to the portal where I input my username and password. That works. I'm going to select my son William, connect, and then Hobby Project has said it's not going to sell my data. And these are all of the fields that Josh's application has. And I'm going to make sure that all are selected. I want as much data as possible. Allow access for 1 hour, it says. And then it's fetching the records. Resources, references, attachments. Your data is being encrypted end to end. Only your AI agent can decrypt it. Okay, it's processing. That took about 10 minutes to do. Uploading now, and success redirecting. And there's an option to send to the AI or add another provider. I'm going to add another provider, and I'm going to add Yale, New Haven, and there is 503 locations. I hit connect, same process as before. It's going to take me to the Yale MyChart portal. Hit login, and it works. Gonna go pick William again. Continue, same deal as before, authorize, and then allow access. And here we are fetching Yale New Haven's records. I imagine that's going to take around the same time for Boston Children's, 10 minutes. Okay, it is uploading, and that took about the same time, maybe a little longer than Boston Children's, and it looks like it was successful. And I'm expecting that dialog window to come up. Success redirecting. We're going to add 2 more, and this time we will upload NYU, Langone, 855 locations. Same exact process as before, using the Smart on FHIR API endpoints. Type in the login and password, and it's taking me to the NYU Epic portal. Continue, same exact screen as before, allow access, and we are starting the retrieval process for NYU. The retrieval process for NYU is done. That's taken less time than Boston Children's and Yale because we are only seeing 1 specialist there. Similar with Cleveland Clinic. We will fetch the data from the 759 locations of the Cleveland Clinic. Smart FHIR endpoints get connected through the Epic portal. Click William, continue, grant access. It's Worth noting that Boston Children's recently migrated from Cerner to Epic a year ago, and this does not include the data that was collected by Cerner. Because William has a heart defect, he has neurological tumors, is deaf, and is failing to thrive. Being undiagnosed, it's important for me to get all the data I can, particularly if he was inpatient while Boston Children's was using Cerner for 3 months. Maybe there is something in that data that might give cause to some of his symptoms, maybe some toxology. So that's all the 4 Epic systems he is seen at. I'm going to select Done, Send to AI, and it should take me back. No, you can close this window and return to your AI. So, or I can download my JSON files. I just used Smart to grab my records. Do you have them? Got everything. Here's a quick picture of where things stand. William is a 4-year-old boy, born March 21, with complex congenital profile, vascular association, complete AV canal defect and coarctation of the aorta, anal rectal malformation and repaired hypospadias, congenital hypothyroidism, bilateral hearing loss. His care is genuinely fragmented across 4 systems: Boston Children's, Yale New Haven, NYU, and Cleveland Clinic. What you would like to do: cardiac status, AV canal repair, coarctation, vascular workup, coordination, growth and development, endocrine, thyroid, something else. How many patients are in the record? William P. Cummings, and that is correct. Is William deaf? This is a nuanced picture. William is not technically classified as deaf in the audiological sense and having no hearing, but he is functionally in that territory. Here's what the records show. His hearing loss is severe to profound and bilateral. His most recent formal audiogram, November 2024 at Boston Children's, showed severe to profound hearing loss. That is not the most recent, so that might be the most recent one, and I don't think that's the most recent one at Boston Children's. The anatomy is unusually complex. Imaging has revealed bilateral lipomas within the internal auditory canals, a small cochlear nerve aperture bilaterally, left worse than right, fixated and dysmorphic middle ear bone. This means his hearing loss isn't simply a matter of damaged cochlea. He is currently using a Baha device, that is correct, which has mother reports he tolerates. He is being evaluated for cochlear implant though his case is complicated by the small cochlear nerve on the left side and the lymphomas. Clinicians are trying to understand which lesions along the auditory pathway are most responsible for his hearing loss. He also has a speech and language development delay attributed to hearing loss. So directly answer your question, Williams is not labeled as deaf in the records, but he has severe and profound bilateral hearing loss that is progressive. That's interesting. So it's progressive. Was William born deaf? Now, this is an interesting side note. We see NYU for his neurology and hearing loss. When we sent over access to my chart from Yale and Boston Children's, they presumed that he was born deaf. William was not born deaf. The records are clear on that point, and the story is actually quite important clinically. He passed his newborn hearing screening bilaterally at Boston Children's via ABR, which is the gold standard test used at birth, so he had measurable hearing function as a newborn. His hearing loss developed after birth and has been progressive. The key factors is that William required ECMO, a heart-lung bypass machine, during his recovery from cardiac surgery, and ECMO is recognized Tier 1 risk factor for childhood hearing loss. Because of this early audiological follow-up, he was recommended starting at 3 months of age. Testing over time tells the story of deterioration. An early attempt in March 2023 Newark Hospital found a threshold for moderate range, and by his most recent formal audiogram in, see, that's not correct, November 2024, he has reached severe to profound levels. So his hearing loss is acquired, not congenital. When we sent the data over to NYU, they did not know that he had passed his near-bone screening. Part of the USCDI, that piece was left out. What was William's most recent encounter? Most recent encounter is February 13th, just 6 days ago at Yale Audiology with Kelly G. It was a follow-up hearing aid check. It was accompanied by his mother. He was wearing 2 Baha devices. At the prior fitting appointment, when sound was turned on, William heard feedback and became very upset, so this visit focused on completing programming and bone conduction, direct settings, behavioral hearing test. Mom reports he's doing well with the device overall. William has been good about noticing when falls off, so fairly routine audiology. What was the encounter prior to Feb 13? Encounter just before it was February 2nd at Yale New Haven. Let me pull up the details. I've done this with GPT, and Claude takes considerably longer to respond, which makes me think it's being a little bit more thorough. The encounter on February 2nd was a follow-up with pediatric neurosurgery. Dr. DeLuna, the note is primarily structured encounter summary without a detailed clinical narrative, but the context here is significant. Dr. Encounter was 30 minutes. Would you like me to search for more clinical detail? So they're talking about implants and cochlear evaluation. There's nothing here about a spot on his brain that we discussed and the need and desire to get a full genomic sequencing. I think that would be important. Yes, I want more detail. William has multiple lymphomas, fatty deposits with the internal auditory canal. What neurosurgeon thinks. Neurosurgical intervention has been advised. July 25th, MRI confirmed the lipomas were unchanged from prior imaging. The broader MRI picture added important details. The left cochlear nerve is absent and the right cochlear nerve is hypoplastic. This is separate from lymphomas, but it is critical finding for cochlear implant decision, which all 3 Boston Children, Yale, and NYU have varying consensus on whether a cochlear implant will work for him. We can dig down deeper and ask Claude more about that if we like. I still don't see anything about, is there a spot on his brain that was discussed? Yes, on January 26th, neurosurgery noted mentioning minor detail. Radiologist found a new tiny punctate focus on signal loss for left, a small area of the brain surface that handles sensory processing. It shows up in the specialized MRI sequencing called susceptibility weighted imaging, which is sensitive to blood products and iron. Small micro hemorrhage from a head injury, but there's more context. It actually has multiple such spots. The deeper 2024 MRI report reveals this isn't entirely isolated, has scattered foci of susceptibility throughout his brain. What neurosurgery concluded. Dr. Cardinal assessment of the 2026 visit was reassuring, has no symptoms from this lesion. His neurological exam is entirely normal aside from diffuse low muscle tone, and there is low suspicion for progressive or recurring process. Repeat MRI in July. Blood draw for the next opportunity to screen for bleeding. CBC, vitamin K, INR. Williams' history of ECMO and cardiopulmonary bypass, which is well known to leave these kinds of microhemorrhagic footprints in the brain. Is there a genomic sequence order? Yes, a whole genome sequencing, exome sequencing was ordered for William, and records tell that interesting story about where things stand, what they're hoping to find. His brother has a RPL5 deletion causing diamond-black anemia, plus the same 15q11.2 deletion, and sister has anosmia. Interesting that they included that piece of data. What was the last hearing test done by Yale? It says November 2024 at Boston Children's, but that is incorrect. I think even for Boston Children's. I want to say that should read July of 2025. The most recent actual hearing test results from Yale, February 13, 2026. Can you list all the hearing tests William has had from any provider? That took about 5 minutes to do. Here is a complete chronological list of hearing tests documented across Williams records, 2021, 2023. Because there would have been, I know there was a newborn hearing, so he was born at Yale, and there would have been a newborn hearing screening at Yale. It's interesting that that's not included. He was transferred at 4 days old. So July 23, December 23, Yale, May 24, Boston Children's, 24, Yale, September, there's the November Boston Children's. Yeah, there's the April 2025 Boston Children's, so it did not give me the correct piece of data when it originally said that its most recent was November 2024. Upcoming sedated ABR is being considered in coordination with the MRI scheduled for July. Besides his newborn screening, has Williams' hearing test results progressed? Yes, clear and significantly. Here's the progression. Sound field testing suggested primary and conductive loss. The bone conduction was near normal, meaning that the inner ear appeared to be functional reasonably at that point, and air conduction was 55 decibels and suggesting a conductive gap. December 23, the first sedated ABR gave a much clearer picture of moderate to moderately severe mixed loss in the right ear and profound in the left. Behavioral testing with headphones at BCH showed both ears now in the severe profound range. November 2024, the most completed formal test confirmed severe to profound bilaterally. The progression is striking and was explicitly called out by multiple clinicians as bilateral progressive hearing loss. In roughly 18 months for mid-2023 to late 2024, William went from what appeared to be primarily conductive loss with a near normal inner ear. The likely contributors to the progression per the records are the underlying structural abnormalities, bone absent, cochlear nerves, IAC lymphomas, compounded by the bilateral middle ear confusion that have been chronically present and difficult to treat given his abnormal ear anatomy. Whether the sensorineural component is still actively progressing or stabilized is one of the key unanswered questions, which is exactly why upcoming sedated ABR coordinated with the 2026 MRI is so important. This is interesting because I do not believe that I would have been told that. I think we started realizing William couldn't hear at 2, and from our observation it seems like he's hearing just as much or as he always has. And particularly if Claude is saying the absence of the cochlear nerve, was that meaning that the cochlear nerve was there at one point? I don't know. Or the absence of the bone. So this is fun. I'm trying to think of what else we can ask it. I can sit here for hours, of course, and continue to go down the rabbit hole. I think it's interesting to call out the importance to make sure that you hold Claude accountable to making sure that it's considering things that you know occurred. I think those hearing tests are an example. I could ask about the cochlear implant. I could start to go into his hypothyroidism and his heart defect and his neurological tumors, and maybe really interested in his failure to thrive. I'll stop here and say that it's important for us to realize that I would not be able to access this type of data had I not used the Smart on FHIR application like the one Josh created. I at least have all that data in one spot to ping and query this as often as I want. I could spend the next 5 hours or 50 hours, and I won't be burdening Claude any. It will continue to answer my questions without any cost or annoyance. There's a lot of things I wish are included in this Smart on FHIR, like the full EHI export, but I think this is a major step forward into how participatory patients are going to enact or leverage their aligned intentions and abundant time to think about their own health or their child or parent's health. Even though we don't have medical education or experience, this energy is valuable to unearth what the diagnosis is or what potential treatments may occur. I hope this was helpful. I'm blessed that The 4 Epic systems that Williams seen by are major health systems, and they have working endpoints. There's a lot of endpoints, as Josh has pointed out, that are not working. And I think there's some steps that need to be taken. One major one is the National Provider Directory, having a enumerable, measurable authority that can ensure that FHIR endpoints are published, maintained, and properly working is paramount to enforcing that laws of the 21st century are at our disposal. I also think that there needs to be some further legislation around the entire EHI export so we can start to put that data into AI interfaces like this. But this is a glimpse of the future, and it's a massive step forward. As I said at the beginning of this video, TEFCA IS would not allow me to retrieve this for my children. At the best, I could use an individual access service to ping the network for my data using a digital credential like ID.me or Clear. All I needed for this was to use my login and password for the MyChart portal. Please comment, let me know what you think. I can continue down particular queries or prompts. I can continue to prompt and ping this data forever. I think maybe I'll schedule some more time to create new areas of concern or interest and ask it for a complete workup and possible gaps between provider care and see where there's discrepancies and see if there are a prioritized list of things the next 6 weeks to 6 months I should be monitoring and following up with. Thank you so much. I hope this was helpful. Reach out to me if you have any questions or if you'd like to play around with this. I'm happy to share this data. Have a great day.